channel. For those of you who are new, welcome on board. I'm Dr. Milad Hilli and I've created this channel to discuss all topics related to health. So welcome. In today's video, I'm going to be talking about the Wuhan Coronavirus, a name which I'm sure a lot of you would have heard of by now. I mean, it's so topical, it's all over our news. Today there was breaking news across our screens about this condition. I hear a lot of questions going around about it and lots of people are concerned. I thought, let me create this video and try and shed some light about this virus and tell you the latest news. Now, this is an evolving story, so if you are watching this video at a later date than the date in which I've released it, please do check the links that I've put down below, because constantly we're getting new news about this virus, so I do want you to stay updated. Story of the Wuhan coronavirus. Well, why don't we go back right to the beginning, to the 31st of December 2019, when the World Health Organization was alerted to several cases of pneumonia of unknown cause in the city of Wuhan in China. Now, we know that pneumonia, which is a serious chest infection, usually has certain bugs which causes it, and it also follows certain patterns. But these cases just didn't quite fit the mold, which raised a concern. By the 3rd of January 2020, 44 people were found to be affected by this condition, 11 of whom were seriously ill. Now, a link was found between some of these people, and that was they were either dealers or vendors working in a seafood market in the city of Wuhan. However, this link between the seafood market and this particular virus has since been disputed. By the 12th of January 2020, further tests began to reveal that the cause of this pneumonia was down to a virus, one known as the coronavirus, which we now call the Wuhan Coronavirus. And since then, this virus has been spreading. It spread to all provinces across mainland China. As of the 31st of January 2020, there had been over 9,700 reported cases and 213 deaths across China and Taiwan. And it has also affected people in 21 countries across the world, including European countries. These include Germany, France and Finland. Over 1,500 people have returned from China to the UK. Of these people, 177 have been tested for the Wuhan coronavirus. On the 31st of January 2020, the UK announced 2 cases tested positive, both who were family members who had come from Wuhan. So what is the Wuhan coronavirus? Well, the Wuhan coronavirus belongs to a family group of viruses known as the coronaviruses, which are common across the world. They lead to a range of illnesses, from the common cold to more severe conditions which can affect a person's breathing. The Wuhan coronavirus is a new strain or a new type of this virus. It's behaving in a similar way to the other coronaviruses which we've had in the past, like SARS and MERS, which has meant that scientists have been able to find tests to identify this virus. Now, these viruses tend to spread through droplets, so that's when you cough or you sneeze. Coronaviruses can spread from humans to humans or from animals to humans. At this stage, we still don't know whether this particular virus can be spread from animals to humans. People who tend to be affected most severely by this virus are people with weakened immune systems. What we do know is that all people who have died from this virus in Wuhan have been people with pre-existing conditions, particularly those with conditions affecting their lung, or people who are elderly. What are the symptoms of this virus? The main symptoms are a fever, cough, shortness of breath or breathing difficulties, and in severe cases, pneumonia and problems with the kidney failure, and in some cases it has led to death. The Wuhan coronavirus has an incubation period of 2 weeks. What that means is it can take up to 2 weeks for a person with this virus to present with symptoms. A lot of people will ask, if I'm coughing and sneezing, could I have the Wuhan virus? Now, the main answer to that is, unless you have come in contact with people who have come from China, or if you've been to China in the last 14 days, the chances of you being infected are very slim. However, if you have any concerns, please always seek the advice of your medical doctor. So why Why is everyone so worried about this virus? Well, any new illness worries us, particularly one which is spread from humans to humans and which can lead to severe illness and even death. At this present time, we are still in the early stages of understanding this virus. Another concern is, as a virus, we can't treat it with antibiotics, which only work on bacterial infections. The mainstay of treatment for people testing positive for the Wuhan Coronavirus is supportive treatment to try and help them with their breathing. So how do we prevent the spread of viruses? Well, whether it's the Wuhan Coronavirus or whether it's any virus, washing your hands is so important. And also, if you're coughing and sneezing, make sure you cover your mouth and your nose. If you're cooking meat and eggs, make sure you're cooking them thoroughly. What I would like to say is that the Chief Medical Officer in the UK has announced that the National Health Service, our NHS, is well equipped in dealing with viruses such as this, as it has dealt with viruses similar to it in the past. There are procedures and measures which have already been put in place. The 2 people who have tested positive for this virus are already receiving support. I'd like to wrap up this video by saying, please stay informed. As I've mentioned before, this is an evolving story, so maybe by the time you've watched this, a lot has changed. I have attached some really important links down below from GovUK and the NHS. Do check them out for the latest updates. Thank you so much for watching. Stay well. Lots of love from me to you all. Take care and bye.